Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hello, everybody, and welcome to the Nourish MD podcast, where we learn, grow, and nourish together. I am your host, registered dietitian Meg Tancredi, and I'm so excited to welcome our guest today, Dr. Courtney Harkins, and we get to talk all about mental health, specifically calming the body, thinking about how we can reduce stress and really what to do when stress decides to walk through our front door in the morning. So without further ado, I'd like to introduce Dr. Courtney Harkins and read a little bit about her background. She's a licensed marriage, family, and child therapist and a certified EMDR therapist who specializes in the assessment and treatment of children, adolescents, and their families with particular expertise in trauma. She is the founder of a private practice in Newport Beach, where she is currently expanding her services to include neurofeedback and brain mapping to further support emotional regulation, attention, and overall brain health.
Thank you so much for being here and taking time. I really appreciate it.
Thanks so much for having me. I'm excited about our discussion.
Yes, me too. I know. So Dr. Harkins and I got on a call earlier, and she and I have a lot of passion for like physical health and mental health, and how like nutrition overlaps with mental health and all of these wonderful things. So she seems like a gem. So I'm really happy to have her on today. So I want to kind of just start with simple, how do we define stress? How does it show up clinically? How does it show up in the body and brain? So I'm going to let you take it away.
Right there. Well, and it's interesting when you say the word stress, you are really talking about the way that you phrased it, distress, because there's good stress, which is eustress, right? But why do you usually go see a therapist? It's not because of eustress. Life is great. It's when we're in distress. So our thoughts, right? Our thoughts, our beliefs about ourselves, our body, it's not working optimally. Our stomach hurts. We have chest pains. We'll have tension in our jaw, right? A lot of body tension. The way that you're thinking about the world, how you see yourself and see others, there's a negative lens to everything. And so at that point, you're like, okay, maybe I should go get some help or do stuff. So just to clarify, we're talking about distress, which is the bad stress.
Yes. Thank you for clarifying that. Yeah, because absolutely there's also acute stress, right? Acute stress. And then there's the chronic stress. Right. And then like I've talked about before, and I know we always hear like the analogy, right? Where like back in caveman days, there was like the threat of the predator, of the lion, and we go under stress. And like now, if we are hosting a podcast or like giving a presentation or something that's not, this ongoing work stress or anything like that, our body doesn't recognize, oh, it's okay. It's just, this short little thing that you're going to do. Your life is not in danger. And so,
but our body will experience that, right? I mean, a lot of people will come in and they still hate presentations that they have to do at work because in the third grade, they mispronounced a word giving a presentation to the class. And so now when something is similar to that, their body goes into threat response. Oh no, I'm not safe. And they freak out.
Yeah, exactly. And so one of the things I do want to talk about today is like, how do we like calm that down? How do we handle that? Because, it would be ideal, right? If we didn't have any stress, if we didn't have any distress going on, but we know that things in life happen, right? And they can be unexpected, or just something that, that's on the calendar that you're dreading. I mean, so it's like, how do we, best manage this? So, one of the questions that I had for you also was, when you mentioned distress and you go into this, oh my gosh, I'm in this
fight or flight. It's really crisis, fight or flight mode.
Yeah. So when it comes to therapy, is that the only time that people show up in your office, or like, do you see people who are not necessarily in a specific situation? You know, why else are they coming to you?
You know, a lot of times a crisis situation, it motivates people to get help. But actually, I don't know if you're seeing it in my field too. I'm seeing a shift into this longevity space of, I want to live well, right? So I don't want to just come into therapy because I'm what should I do with my career? I'm thinking things. I do feel in crisis, but you know what? I want to live my best life. So I am seeing people take advantage of therapy when they're not in crisis to say, I can build better habits. I can actually do things better. Let's get a hold of it. And let's go back to things maybe in my past that I think have maybe negatively influenced me, or maybe some good have come out of some bad spots we've been in, but we can relearn, we can respond differently. So I'm getting more people that they're not being defensive about it. They're being proactive, which is amazing and really fun. But still crisis is a big part of the work that we do.
Yeah, right. Absolutely. Well, I really like that you said that there are more people who are being more proactive about it, open-minded about it, because I think there still exists like a big stigma with therapy being as like it's bad or it's shameful. Right. So it's nice to hear that people are a lot more maybe open-minded and receptive to, you know, how do I enhance my life? How do I, you know, improve my, you know,
my overall well-being?
Yeah, exactly.
And I think I have some thoughts on why is there this stigma on mental health?
Yeah.
A lot of it came from the way the insurance is set up, because they're only going, if you're using your insurance, you can only get your therapy paid for if you have a diagnosis, right? So
yeah, that's a good point.
But a lot of therapists have moved to a private practice model where you don't have to have a diagnosis. It's your relationship with a therapist and you can dictate the treatment. It's not dictated through the insurance company you know, it's laughable to me. A lot of times, it looks like you have ADHD, but you only have 9 of the 11 symptoms. So then you don't. It's like, well, really? Come on. Obviously you're not functioning in the best way. You still need support. So let's figure this out.
Yeah, that's a really good point. It's kind of like, oh, your stuff isn't as bad as it needs to be to get the help, even though you're going, well, I'm not really functioning as well as I think I could in my daily life. Maybe it's impacting my work productivity, my just mental health, about how I feel in general, whether it's body images or mood, right? Anything like that. So it's like, oh, it's not bad enough. So hang in there until it gets to be bad. And
Good luck. Yes.
Yeah. Right. Like that comes to mind. Like, so in my field, like I look a lot at blood sugar regulation, right? Because blood sugar impacts everything from head to toe. And I talk to patients about this, and I'm sure at some point they're like, okay, Meg, like all you do is talk about blood sugar. But like, I think about like the lab markers that we use for this and how they have to be bad enough to have the diagnosis, right, of prediabetes or type 2 diabetes. And I'm like, why are we waiting for that? Let's get ahead of it, because it's actually a little easier, right, when things haven't gone down the dark hole. So let's start now and do simple changes. And so like, to your point, it's like, hey, if I know like I can be better in this field or this category or optimize something, like, let's do it. So it sounds like that's the kind of approach that you take, that you're a lot more on the proactive side too.
100%. And because actually I'm so thankful you brought up blood sugar, because that is my new obsession in the mental health field.
Woo!
So
that's awesome.
I'm sitting here going, when we spoke earlier, there's a couple things I'm like, why was this not taught I was in school, just a little background. It took me 2 years to get my master's degree. And then I had 3 children while getting my doctorate. So it took me a little bit longer.
That's a lot.
Yeah. It took me 11 years, went part-time. So 13 years I'm in graduate school, right? Never once did we talk about blood sugar, which for me right now, it's like, this is the crux of so many problems that I'm seeing. And I'm actually so excited right now to be in this space, because we're seeing changes in our nutrition guidelines. So I'm guilty of this with my kids too. I would start off the day with cereal. Okay, our kids, myself, my body is super sensitive to that stuff. So my blood sugar skyrockets, right? And then for some, mine drops really low. So I feel really moody. I see this a lot in my patients. You're not bipolar. You don't have the bipolar diagnosis. Your blood sugar is off. So why don't we start our day by having balanced blood sugar? And when we do that, we will see a lot of the anxiety and depression. I don't want to say they totally go away, but they're so much more manageable.
Yes.
It's this beautiful, it's so wonderful. Stable blood sugar. Let's start there.
100%. Oh my gosh. Okay. You're my new BFF with blood sugar. I joke around sometimes. I'm like, sometimes I want to have like a shirt that says, eat more plants or go for better blood sugar, like something, because it's just, there are such simple ways that we can improve our mood, right? Through dietary and lifestyle habits. And so, I come from the mindset of like, there are medications that 100% help with all sorts of diagnoses and issues going on, right? And then there's also a lot that diet and exercise, getting good sleep, managing our stress, which is what we're talking about today, and how those are things that are in our control, right? And we can do very simple things by eating a balanced breakfast, making sure we've got protein at the early start of our day. Because science is there. This isn't just like hippy dippy stuff, right? Like we're showing, like science shows, when you consume these nutrients, when you have stable blood sugar, mood improves, depressive symptoms go down. So that should be
anxiety. I see a lot of young men and older men come in and their blood sugar is all over the place because they're not having the protein and the good healthy fats to stabilize it. So they'll grab a handful of pretzels because that's what's in the office. And then boom, they go hypoglycemic, causing panic and anxiety. It's not, yes, it feels like panic and anxiety, but it's really your blood sugar dipped too low and you're not stable.
Yeah. This is why, like, that fun, the real scientific term, right, is hangry, when people get real hangry. And I notice it with myself, right? But I also think about people who might not be as tuned in to their bodies and hunger cues and level of satisfaction, like all of that. So it's really important to make sure we're dialed in. Hey, I am hungry. When was the last time I ate? How am I feeling right now? Like, because sometimes we can become more impatient. We're more irrational. Our prefrontal cortex has gone offline because we're like, hey, I'm hungry. Like, feed me. That primitive stuff comes into play, right? So, I think talking about blood sugar all day long is great.
Can I ask you a question on that? Yeah. I put myself and my husband on a continuous CGM. Yes. And that was like life changing for us. So if I ran the world, I would put everyone on a CGM just so you can know, because I noticed when I didn't get enough sleep, I would wake up with higher glucose levels. And I noticed for myself, other people who've tracked this too, then we kind of crave more sugary foods, but then we're just setting ourselves up for a bad day. And I had to go gluten-free. So I was eating a ton of rice, thinking that I was doing something really great for myself. Right. It wasn't until I wore a CGM that for me, my body took the rice and it was like as if I was eating a candy bar. So for all of these years, really, I thought I was being healthy. I wasn't. So I love for people to use these new like technologies, interventions out there. To your point is, well, let me get to know myself because, I came across really angry and irritable at my wife or my kids. Oh, my blood sugar, I'm really low, or it went too high. And it's like, know your body. And then from that, you can create different responses and better habits for yourself to manage.
Okay. Life. I'm going to let you just talk to our patient. Like, this is great. And hey, everybody who's listening, I did not pay her to say this. We didn't even talk about CGMs prior to this. So it's refreshing to hear that also because, oftentimes we're just so isolated with, nutrition is only this. Mental health is over here, weight is up here. Like, they're all isolated when they're all intertwined,
all connected,
right?
All
and
connected.
So, you're absolutely right. Like knowing your body, knowing your physiology, how your body is responding to things, and also knowing there's other things impacting blood sugar and what those are: stress, lack of sleep, choices, that sort of thing. And then also how that manifests. So like when you talk about knowing yourself, I think when it comes to like a stressful situation, where you're kind of freaking out or you're nervous or you're having some kind of reaction to it, it's knowing how you typically respond, right? And is that helpful to you or is that not helpful, right? So when I work with people, and I'd like to know what you see too, when I work with people, emotional eating is a big thing. Like I'm under attack. I'm in a stressful situation. And now I'm going to go, I'm not going to go pick a bowl of broccoli to eat. I'm going to go pick, something that's higher carbohydrate or higher sugar, right? Because that helps calm down. That's a comfort food, right? So that's soothing to us.
Right.
And so I see that a lot. So the emotional eating is a big thing. I feel like both men and women do it for sure. I hear women do it. I think we tend to be a little bit more, maybe in tune with our emotions, or maybe we have heightened emotions, which is not a bad thing. I think it's extremely important to feel your emotions, and acknowledge them. But I'm curious, like when people are under stress, like what are the behaviors or the reactions that you see that people have?
No, you've nailed it. When we're under that stress, you're talking about the distress. So it doesn't feel good. I want this painful situation, this painful feeling, the tension to stop. So what do is we utilize short-term strategies that a lot of times are not good for us. So maybe we learned them in our childhood. Our parents did them. So we just kind of picked up these habits. And emotional eating, 100% guilty as charged. Okay, I'm going to I love chocolate. Chocolate feels amazing. Or I work with a lot of high school kids. They love high chews, just FYI. So I'm going to grab some high chews. Well, we're getting a huge amount of dopamine.
Yeah.
And so when we get too much dopamine for not the right effort, we create, that's part of the emotional eating cycle that we get in, because it feels so good and I want relief from my distress. Yeah. So I've given myself something not so good, emotional eating, or we'll scroll on our phones too long, or because it does make us feel better short term, but then we've created a long-term problem for ourselves. So how do we get ourselves out of that rabbit hole that we've created? But we mean well, we want the distress to stop. So I'm going to try and do something that makes me feel good, but we've got to change our habits to pick more healthy alternatives. I'm going to go grab some, I don't know, I really love turkey and avocado. So I'm going to go grab some turkey and avocado rather than the chocolate that I love too. Or I'm going to go on a walk. And a lot of times when our distress is up, moving our body is one of the great, it's something fantastic you can do in 5 minutes, 2 minutes, 5 minutes to help get emotions have energy, to get that energy out of our body so we can start to stabilize it.
Yes, exactly. So with movement, because I'll say, hey, I think one of the best things is to go for a walk, because after 10 minutes, I personally can feel like, oh, that energy is dissipated.
Yes.
I feel better, right? Mm-hmm. My head is a little bit more clear, and it also gives you that space, right? From being reactive.
Yes.
And potentially making not such a good choice, right? So it's giving yourself the space and now get out of here, go for the walk or go move. Are there any other forms of movement that you encourage people to do, or that can help get rid of that nervous energy or anything like that?
Well, it's getting in control of our breathing. So this came from Dr. Andrew Huberman, gets all the credit, but to do the double inhale and then exhale longer, he says that is the quickest way to get to reset our nervous system. So there's that. And funny enough, I'm married to a musician. He has a real job, but his love is music.
Real job.
Sorry to those musicians out there, but if you live in my world, you understand my comment. Singing and humming actually is a fantastic way to help calm the nervous system when you're feeling really stressed.
Yeah. I've read a lot about vagus nerve. And the humming specifically is really good at soothing that. And so I I have tried, and I think it's hard to remember to hum. I like to sing. I like sing around the house, which I think is also
it's supposed to help too. Yes.
Okay.
Yes.
It's good no one hears me sing, but
but for your own, right. No one's home.
Yeah.
You let it out. It's all good.
Okay. So if someone were to start singing or humming, like how often are you supposed to do that? Or, is that just something you just do like once a day, or is there like a structure to it?
You're asking some great detailed questions. Maybe there is some research on that. I'm not available. I don't know. I haven't read it.
Oh, okay.
But
we'll get back to you guys about that. Because you and I are, I think, the type that we're going to go and like research this, because I think when you have a structure with like the humming or anything that's like vagal nerve related or just anything like that, like I think having a structure is probably going to be like super helpful. So we're going to get back to you.
We'll come back.
Yeah. Yes. I would, and this is when I talk with patients about like a goal, right? I'm not going to tell them to go from, for example, like with drinking water, because oftentimes it's like, oh, I have to drink water. What's that? Mm-hmm. And, so if I tell someone all of a sudden, I need you to drink 2 liters of water, and they're only drinking like one of those like little 16-ounce bottles, they're going to look at me and be like, oh my gosh. So maybe like with the humming part, it's like, just start humming and enjoy it.
Exactly. Yeah. And when you enjoy it, that's so key on a lot of this. If you can create enjoyment out of these practices, you're going to do them more.
Yes, exactly. I've had a couple gals recently, because we'll talk about exercise, moving your body and that sort of thing. And so, it's like, tell me what you do like to do.
Yes.
Right. So if you like to go do Zumba and move, like, and dance and hear music, like, go do that. Right. Because it's the same thing, like with food or any other category. Like if it doesn't sound good, like I'm not going to do it. But.
And your body goes into that like threat response. So you get tense, you don't want to do it. You're making it harder than it needs to be.
Yeah, exactly.
Transform your health with PPMA's personalized support from our expert registered dietitian. Get the clarity, confidence, and tools you need to feel your best. Visit privatemds.com to get started today.
One thing I wanted to ask you about, so I'm looking back over here at your bio, and do you want to talk a little bit about what EMDR is? Because I read that, and I'm not sure if everybody knows what that is. So I think that would be good to clarify too.
Oh, I would love to. I know. Do you have 5 more hours? No. Yeah. EMDR stands for eye movement desensitization and reprocessing. That is a mouthful. It really is my favorite type of therapy. If you're not sure about therapy, it's been picked up in the news a lot. I love it because it works. It is so effective because I'm going to tell you about TICES. Thoughts, images, cognitions, emotions, and sensations. Oh, okay. So EMDR therapy, it integrates all of the human person. We all have thoughts. We all have images. Well, we all have cognitions, beliefs. We all have emotions, and we all have sensations. So EMDR therapy targets all of that. So whatever is causing you distress, like for example, my daughter was in a car accident a few years ago. She's fine. But she came in, right? And then the thought of going into a car was distressing for her. Yeah. So I asked her in EMDR, you ask, well, what's the worst part of it? And this is what's so fascinating about EMDR, because if anyone else has been in a car accident, their worst part can be different. So for my daughter, it happened to be hearing the impact of the other car crashing in. It was a sound that was causing the distress. Okay. My son was in the car too, and he had a different worst part of it, which was seeing something. So for me, EMDR, it honors the whole person. It honors for them what is the worst part. So for my daughter, it was the sound, and the sound of it made her have the belief of I'm not safe, which is, luckily everything was okay, but that is true. But a lot of times we get stuck in our distress. So I'm not safe. I'm not safe. I'm not safe. Every time you get into a car, that's not going to be helpful for you. You've got to learn how to respond differently. Yes, you were in the car accident. It wasn't fun. You did survive. And so to change our negative cognitions, our negative beliefs around distressing events, trauma that's happened to us is so critical. So it integrates then the thinking part of it. I'm going to think about this differently. That's more helpful for me. So to go from a negative cognition of I'm not safe to a more positive one, a more realistic one. I was safe. I did have choices. And then it goes into the body. Okay, well, when I hear that sound, I think about this sound, my stomach feels like it drops from out of me, or I can feel my heart racing. And so then we integrate it all through, it's called bilateral stimulation. So we help the brain have the left brain and the right brain talk to each other, because our emotions are stored in the right, but we really want to wake up our logic and our reason. We don't want to stay stuck in the emotional part of our brain.
Yeah.
So through bilateral stimulation, we're integrating the emotion with the reason. And then we can like flesh out the sensations in our body. And then we're not forgetting the memory. The car accident still happened, but now she can respond to it. I'm okay. I am safe. Not every time I get in the car is going to be an unsafe situation. Did that make any sense?
Absolutely. No, I mean, I think it's great. I've heard of EMDR. I personally have never experienced, but I think it sounds really helpful, especially, I mean, I think there's a lot of people who have gone through some sort of experience, whether it is a car accident or something similar, and they're just stuck.
Yes. Yes. The emotions are so overpowering. We store trauma in the emotional part, and that's where it gets stuck. So that's where we want to flip on the logic, the prefrontal cortex, and the reason part of our brain to view it differently.
Yeah. I really like that. Well, that's great. How, like on average, I mean, I know everyone's different, but is there like a certain number of sessions you usually do EMDR to see like that breakthrough?
Great question. So if someone comes into my office, they have good relationships, they don't have a long history of mental health issues, they were in this one-time car accident, I can resolve that in typically like 1 or 2 sessions. Like you're done.
Oh, that's so great.
It's amazing. But if you come in, maybe you're going through a divorce, or you just had a breakup, you haven't been sleeping well, you have a lot of stresses at work, then it will take longer because we need to build some resourcing skills. Okay. How do you help self-soothe yourself before we get into the trauma and dysregulate you more? And then the car accident would be called, that's like a one-time situation. Yeah. But a lot of times people do come in with traumas that have built upon traumas. Mm-hmm. So as we're targeting what brought you in to therapy, it's really related back to a lot of other traumas that are in your history. And that takes longer to get through.
Okay. That is great. I love that. Like that. I love that that's a service that you offer.
Oh, it's so amazing. And we use it, we talk about trauma, but we use it for depression, and anxiety, because again, I mean, that anxiety, you're holding it into your body. You feel it in your body a lot of times. So we can target the sensations that you feel in your body and how it's related to usually maladaptive thought patterns.
That's really great.
Yeah.
Yeah. Great. I'm like loving this conversation. One thing that I had heard someone suggest, you hear these things. When you're afraid of something or really worried about something, I think it's easy to allow that to just kind of consume your thoughts, right? Like, oh, I'm just worried. I'm worried. And then when someone actually says, what is the worst thing that could happen? And then you actually write down what is the worst thing can happen. And you're like, oh, it's not that bad. Or, it's really something you can't handle. You're just more anxious about it. Right. So do you ever have people do like writing? Does like writing exercises help?
Oh, 100%. Yes. Because a lot of times it's bigger in our head. And so when we externalize it, when we put it down, well, what are these things I'm really worried about? I'm afraid it's going to happen. And you start to list it. You're like, oh, okay. It's not quite as big or as awful. I can get through this. There are steps. I can figure this out for myself. And also, I just had this powerful session last night. Besides writing it out, listing, sometimes if you draw it out, what does the dread feel like? What does the anxiety feel like? Show me. It's amazing. And then what do we need to defeat this, right? How can we take this big anxious stress monster that's in your mind and your body. How do we make it smaller so it is something you can overcome and defeat?
Oh, I like that. I have goosebumps. I love stuff like, I think that's so great, because once you identify it, and I'm sure like with you, it's, it's like, it's a safe space. We're talking about things that make people feel vulnerable and worried, and how is she going to perceive me? Or like, all of that. So like, that all sounds really,
it's fun. Therapy can be fun.
And yeah, I really like that. What are your thoughts? Because oftentimes, I work with people in their 50s, 60s, 70s. And sometimes, everyone's got their own experiences, childhood, all of the things, right? And so sometimes, there are comments that people say of, well, I can't go to therapy, or I can't do that. I'm too old for that. I've been doing XYZ for so long. How would I even go about, so it's like, do you need to be at like a certain level of change, like a state of change to be like, okay, now I'm ready to go and address this? Or can someone who's like, well, I'm kind of curious about therapy, maybe it could help me get unstuck with this. Like, what would you like say to people who are listening, who are in that category? Like maybe like reassure them, like therapy is okay. And like, this is like, how would you address that?
Great question. I do find if you're kind of hesitant about anything, if it is changing a diet or starting therapy or exercise program, that hesitation a lot of times will kind of pull you back a little bit. You're afraid to kind of go all in. Right. So if you approach it with a more positive attitude of, I really do think this can be helpful for me, I'm going to see what can I get from that. You just allowed yourself to be more open to good suggestions or to good ideas versus approaching like, I'm not so sure. I mean, we get really distrustful. But to be fair, we were talking earlier. I probably shouldn't say this, but it's okay to be distrusting of therapy because there have been some bad ideas out there. So I do want people to understand, or to give them the freedom of, if you do try it and something doesn't sit right with you, that's okay too, because there's been some really wacky ideas unfortunately in my field that aren't helpful, but there are a lot of good too. And so sometimes it's a feel of, I just don't feel comfortable with that therapist too, or his or her approach isn't aligned with my worldview. Yeah. All of those things are super important. So just because maybe it didn't work the first time or wasn't a great fit, it doesn't mean someone else can't be a good fit or a good strategy, a good modality, because therapists, there's so many different ways of how you approach mental health. So really make sure you find and pick a therapist, a psychologist, a mental health practitioner that's really in line with your values and your worldview.
I'm so glad you said that. I think that's really important. I mean, I've interviewed someone else, and he had said, he's a physician, he's a surgeon, and he had said, hey, everyone who's listening, always get a second opinion.
Absolutely.
Always get a second opinion. And then what you're talking about also sounds like, listen to your intuition, listen to how your body's responding. Like if something doesn't feel comfortable to you, there's probably a reason why. Right. And we know, like when we are going to change something or set boundaries or like whatever it is, it might feel a little uncomfortable, but like also really like at the initial stage, right. Of like, talking with a therapist or a physician or a dietitian or whomever, if something that they're saying does not align with your philosophy, then go somewhere else. It's okay.
Yes. And don't try and do mental gymnastics to make it fit, because right now on the field of mental health, I mean, there are some ideas out there that I think are actually really harmful. So just be really aware of that. So
is there something in particular that you think is there like a popular like trend going on right now that you're like, please don't do this, guys?
Yes, there is. Again, it's not in every program. It's not everywhere, but there tends to be right now in the education system in general, this focus of almost being a victim versus getting yourself out of it. I mean, things happen. If you are a victim of something, that is true, but to stay in a victim mentality mindset, ultimately it's not going to be helpful for you. So like EMDR, we look at what are the negative beliefs that are holding you back. And so if we stay stuck in the negative beliefs, that's not the point of therapy. The point of therapy is to say, gosh, this really terrible thing happened to me. Like that is true. I'm not saying it didn't. I don't want to minimize it. And also good can come. I can learn things. I can get better. I can make different choices. I have agency over my life. And so there are specific modalities in therapy right now that unfortunately, it's more about validating the victimhood mentality, which it's not my belief set. So,
right. Well, I really like that because I think, and I hear similar things, right, with nutrition, right? Like, well, I don't like A, B, C, D, E, F, and G, and then that's it. It's like, okay, well, let's look at what you do like and what's going to align with your health goals, right? So like, let's 100%. Shift our focus from, well, I don't like all of these things. That's fine. I will take note of that. I will not make you like eat those things or do the things, right? That's okay. Let's look at what you're capable of doing. Let's look at what your preferences are, what's going to help empower you and feel good in your choices so you can keep feeling better and increasing energy and all the things, right? So I definitely agree with that. I think it's perfectly fine to, experience the emotions around whatever that situation is or was, right? And you can feel sad and you can grieve because we know grief comes around the corner out of nowhere sometimes, and that's okay. And then it's also like, how can I shift my thinking to what's in my control? What can I do today? Even if it's like one small thing, right?
And really it's those one small changes that over time add up to these amazing changes.
Yeah.
And for me, the best approach too is to start really small. I've noticed sometimes we get all excited at first, like I'm ready for a big change, but it's hard to keep up the momentum.
Yeah.
When you're much more successful, okay, can I do tomorrow? Can that be 1% better than today? Can I eat 1% better than I did today, than yesterday? Can my mood, can I think about a situation slightly more positively or slightly more neutral than the negative stance I'm typically in? Just slightly. Yeah. And then it starts to build momentum.
100%. I think you and I have the same brain. I don't know what's going on here, but that's what I talk about all the time. It's just, little, little tiny changes, because making any sort of, dietary change or behavior change, right, can seem very overwhelming, which causes people to be stuck and paralyzed. And I can't do that, right? But you're like, what? 1%. 1%, like something a little bit better the next day. And I think we all could.
We can all do 1%. Absolutely. Yeah. And I stole that. That's from Dr. Jordan Peterson. So that was not an original idea. Giving credit where credit is due. But I thought that was profound.
Yeah. No, I think that's a really great way to look at most things in our life, right? What's something that I could maybe change, I feel a little bit better about, that aligns with how I want to live my life, gets me to my health goals, physical or mental, and go from there. I think that's great. Well, I think on that positive note, I think we're going to maybe conclude, and maybe, is there, I feel like that is the piece of advice. I was going to say, like, what's one thing you want to, instill upon listeners, as far as, stress or therapy or anything like that? I feel like that was really helpful. Is there anything else that you would want to add?
Oh gosh, hope. We always have hope. You know what I mean? Like no matter how bad or tough a situation is, goodness is always around the corner. It really is. But we do have to look for it.
Yeah.
We do have to be open. We have to allow ourselves. We have to do the work, have that soil that will take in the nutrients so you can grow. But it's a hopeful time. It's a hopeful place to be in. We're learning so much. The landscape is changing so rapidly, but there's some really neat, cool things like on the horizon. So yeah.
Well, you are just fabulous. Dr. Harkins, thank you so much for being here. I feel like I want to come see you and talk about EMDR. I'm like, this sounds so interesting. Like
you should just come in you just to experience it. It's my favorite thing. I love it.
I think it sounds, I'm very like open-minded. Like I'm very pro, like, let's talk about our feelings and talk about all the things and, just all like constantly, how can we improve? So, I mean, I think your philosophy and your approach sounds really holistic and empowering and proactive. So I just thank you for being here today. I appreciate you so much.
Thanks for having me. And I'm excited. I feel like I'm in this lone world of, okay, blood sugar. I love blood sugar. I love good blood sugar. And so I need to build my team too for when there's mental health stuff. Who can I go refer people to help support them? Cause you're going to feel better. Your mood, your mental health will be better.
Exactly.
With good blood sugar too.
Yeah.
So.
All right. Well, we can be the dynamic duo. So,
yes.
So thank you again for being here. And listeners, thank you for joining us today on Nourish MD podcast. You can listen and follow us on Spotify and Apple. So thank you so much. Thank you, Dr. Harkins. And I hope you all have a wonderful day.
Take care.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.